Dave Nelson joins me now, and he's with the Canadian Mental Health Association. We've heard, Dave, from so many families that are heartbroken, these stories of losing their children, and then we hear from the health minister who says, we want to have conversations, but no promises of action. The system is broken according to the parents. What are your thoughts?
Well, you know, it's ironic because there has been a real increase in awareness now about what's needed in mental health. The government went through a 1.5 year long mental health and addictions action plan, which has got very good things in it. The federal government is able and willing to give money to the province for mental health and addictions, but there is no money going into the system. As a matter of fact, access is about to get a bit worse because they're actually taking money away from the frontline services. They're reducing the community-based organizations that people typically can go to first to get help before they have to go to more expensive services. They're actually talking about taking 10% away from that. So this actually makes no sense either from an economic point of view or certainly from a service point of view. And we're just very, very concerned about what the government's doing in this regard. They should be putting money into those frontline services to save money into the more expensive clinics and emergency rooms and inpatient beds that people may eventually need.
There is so much more awareness through a number of campaigns about the importance of mental health. Are you feeling like the government doesn't get it, that it doesn't understand the value of it, or why that money would be cut back from those CBOs, for example?
Yeah, we're kind of, I'm dumbfounded as to why they would, it's a very ill thought out plan to take money out of a system that has been woefully underfunded. You know, this province only puts about 5% of its health budget into mental health. The average across the country is 7%. That puts us well over $100 million shortfall. And so, you know, an action plan should be over 10 years saying, okay, if that's the shortfall, let's in a very planned, focused way, put that money back into the system. That's the good thing, it's over 10 years. And on top of that, there's a federal transfer fund that is going to put about an average of $15.8 million a year over 10 years for a total of $158 million into mental health and addictions. Why isn't that happening, and why are they pulling back services now?
They say the money's just not there.
Well, I guess maybe they ought to look a little harder, because I think the money is there and they should very much try harder to do that. Even if the money's not there, within a government, that's actually a judgment call. And when you start taking money away from the most vulnerable in our society, like they're doing with the SET program, of taking money from, you know, the whole point of the SET program, in addition to giving extra money, was to allow people to be a full citizen in our society, people with long-term and enduring disabilities. And their own disability action plan really points to the importance of that. So what do? They take money away from people so they can't use it to go and visit their friends and socialize. It's a matter of prioritization. I think the government's done the kinds of things it needs to do to get back on balance. Those are the big picture things, but it just seems actually mean-spirited now to go after people who have really very little way of fighting back when they're on a SED program, or families who are at their wits' end and they need help for their children or whatever. Why would you go after that by either not putting money to build up a system or taking money out of the system? It just makes no sense.
Thanks for your time today.
Okay.